The report emphasizes the fact that we've had some successes since the beginning of the global fight against HIV. The other pandemic, we like to think of it as, we have, dramatically reduced the numbers of new infections being transmitted to children. And that's undoubtedly a result of the tremendous activism, enthusiasm and commitment of the global community to get women identified and treated with HIV drugs to prevent them from transmitting to their kids. What we have learned at UNICEF is that we have to be contextualized in our response. We have to look at the data and identify what is driving infections amongst young women, amongst children, where there are the gaps in terms of coverage of treatment services, and we have to target our responses. Just as an example, in many countries in sub-Saharan Africa, women are tested when they first show up in antenatal clinics, and if they're positive, they get started on antiretroviral treatment. That's great, and it's been incredibly successful as a strategy. But if you're in a country like Zimbabwe or Mozambique, the incidence of HIV is so high that during the time that a woman is pregnant and breastfeeding, which in many cases lasts 2 or 3 years or longer, there's a chance that as a young woman, she's likely to acquire HIV in that period. And the fact is, we're not doing enough to prevent those pregnant and breastfeeding women who are HIV negative from getting HIV infection. The other issue is that HIV is a lifelong illness. If you don't maintain treatment services, if you don't make sure that women are getting access to the treatment they need and taking the drugs effectively, then you won't see a continued and sustained response to the treatment. And you'll get these breakthrough transmission events where children continue to get infected despite our best efforts. I think COVID-19 has been a real wake-up call for us all. We've recognized really how fragile some of the gains that we've made are. And the fact is, during the worst months of lockdown, people were frightened to go to hospitals. Often when they went to hospitals, their clinics were shuttered because their staff were busy dealing with the implications of COVID. And even if they were in the clinic, drugs may not have been available because supply chains were so disrupted. But at the same time, it's been a learning experience. We've discovered that communities can actually treat people with HIV, that you don't need to give people a prescription every month. You can give them 6-month prescriptions or 3-month prescriptions and put them in charge of their own care. As with every World AIDS Day, we continue at UNICEF to call for the global community to recognize where we have failed children and mothers and to redouble our efforts to try to get us back on track